You ready? Okay, ready? Hi. Okay, we'll have your notes. We'll put them here. Okay. Hello, Kitten Fuzz. Hi, yeah. Okay, so today Mama Cat and I are going to go through giving liquid oral medications to cats. So this is a skill that I think that you should practice, and my recommendation is to get the supplies that you need. So usually that's just some type of syringe, and they do come in different sizes. And practice giving your cat something that actually tastes good and that you know they like the taste of. So you can get the skill of giving the medication down before you start struggling with trying to give them something that doesn't taste good. It's the type of thing where no matter how much you practice, if you're giving them something that doesn't taste good, it's never really going to be a pleasant experience for them. So having the skills down first is really helpful, and then you can just sort of get it over with once you're giving them something that is not palatable. So what I usually recommend, and I find to be most helpful, is working behind the cat. You tend to have more control over their body. You can use sort of your body to restrain them and to sort of move them around. And then you can use your arms as well, which frees up your hands to do the pleasant things like petting them in areas where they typically like, so that you're still controlling them, but in a way that they actually find positive. So I'll stand in front of the cat. So I'll stand behind the cat and, like I said, just sort of rub around their shoulders, rub around their neck and around their face. And what I'm going to want to do is I'm going to want to control their skull. One thing that I find people will often do is when they try to give medication, they hold the head in such a way that you're kind of holding the mouth closed, and then it makes it harder for you. So you really want to free up the lower jaw and just hold on to the top of their head. So like this. And then what that does is it gives you the opportunity to open the mouth more comfortably. And what we're gonna do is we're gonna aim to put the syringe just into the corner of her mouth as opposed to in the front. So a lot of people will try to open the mouth and then put the liquid in, and that is something that tends to not work very well. So we're gonna get it into the back of their mouth, into the cheek pouch, and give it that way. The last thing that I find a lot of people do is they think, well, let's, just try to get it all in and get it over with. But if you're putting in a large volume of liquid, there's a higher chance that they're gonna drool some of it out, that it's gonna be distressing for them, and that it's gonna make it harder next time you try to do it. So every time a cat laps with their tongue, they bring up about like 0.1 milliliters of liquid, and they usually swallow after about 4 to 6 laps. So in reality, the most that a cat usually would swallow is like less than half of a mil, which is a small volume compared to what we need to sometimes give them in order to get them a full dose of medication. So Mama Cat and I are here. We're in a position where she looks like she's much more comfortable on the table. I've just been pedaling her and handling her and sort of touching her head, and so she knows what to expect and what's going to come. I'm going to take my syringe, which I filled, so Mama is on a hypoallergenic diet, so she's getting some rabbit maintenance gravy just mixed in with water, and you're going to figure out how you can comfortably hold that syringe so that you can give a very small amount of liquid multiple times. So practice this before you even try putting anything into your cat's mouth. Can you adequately control the syringe so you can control the volume of liquid that's coming out? So for me, I find palming the syringe tends to work best, and using my thumb to depress the syringe to give the medication. And one of the reasons I find that to be super helpful is I can use the rest of my hand to sort of pet them without having to readjust the syringe if I need to take a break or do something else. So Mama cat, we're gonna give her some pets around her mouth. Okay, we're gonna give her some pets around her head. And then we're gonna isolate her skull. We're gonna turn her head a little bit. I'm gonna use my back arm to stabilize her so you can see how she's wedged in between my elbows. I'm gonna find the corner of her mouth and I'm just gonna give a little bit of liquid. And I'm gonna give her a sec. And then I'll come back and I'll do it again. I'll come back and I'll do it again until we're completely done. Now, it might be that she's gonna need more breaks. I might need to let go of her head. If I do need to let go of her head, I'll try to still control her body so she's not jumping down. And then I'll also, like I said, sometimes if I need to give them some positive reinforcement during it, then I'll just stop and give them some sort of pets. She hears something outside. So once again, we'll pets, 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 medication, pets, 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 medication. So that is giving a liquid medication to a cat. So that is giving liquid medication to a cat. I have a larger syringe that, oh, you're so hairy, Mama. Well, I have a larger syringe that I'll use as well. So I'll just show you another way to restrain them. So some cats, when you try to do this, will bring their paws up and sort of try to paw your hand away from their mouth. So what I find to be really helpful with that is I will use a towel or some sort of light blanket, and I'll make them a little wrap so that they kind of have a neck component that's a little bit thicker than the rest of the blanket, but long enough that it'll prevent them from lifting their paws up to move me away. And so with Mama Cat, we'll just bring it in, we'll put it under her neck, and then we'll lightly restrain her that way. So depending on your comfort level and your cat, you can either just hold onto it like a little handle, or you can fold it over and then use your entire body again to just sort of restrain them. So that's what I'll do with Mama Cat. So we're gonna go ahead, we're gonna give her some pets, and then we're gonna come on in, and we're just gonna give her a little bit of liquid. Good, we're gonna give her some more pets. A little bit of liquid. This is just gravy, you lucky lady. A little bit of liquid. This is obviously going to look easier than when you're trying to give medication because this is something that tastes good. But this is what we're aiming for, is this sort of relaxed state with giving the medication while you're practicing. So what I mean by that is we want you to get the skill down well enough that your cat will just sit on the counter, let you handle their mouth, and not try to leave in between getting sort of doses. So if you're not achieving this, then you need to sort of slow down and take another step back. Okay? So like I said, what else a lot of people will do is they'll try to come in, open up the cat's mouth, and put it in the front of their mouth, which is much more awkward, and you can see that putting a larger volume is more challenging. So the other thing to mention is most medications, you want to give the full dose right away, but you can split it up and give a small amount like every 3 to 5 minutes, or up to, if it takes up to 30 minutes, and it probably is still going to have the same effect in most cases. So if your cat needs a break, it's okay to give them a break in between mouthfuls. I just recommend having them in a small area where you know that they're not going to escape to somewhere if you only give them part of the medication and they're not going to get the rest of it. So a small room where there isn't a lot of hiding spaces, but making sure that you provide them with like a space that you can access them where they can hide. So if your cat likes their kennel, that would be an option. If they like a box or something like that, or to be under a towel or a chair, and you can easily move those things to retrieve them again, then something like that, so they have a place to decompress in between doses, is strongly recommended. Okay, so Mama's pretty good. I'm gonna show you what it looks like if I give her a medication that she doesn't like. So we'll just go to another video for this last part. Good job, Mama. You're a trooper.